Welcome to Public Sector Transformation Week. This is a dedicated week to reflect on and celebrate the transformative and innovative landscape of our public healthcare system and how we are responding to the changing healthcare needs of our population. So let's take a look at where we are, look at the evolving landscape in terms of healthcare. So our service transformation programme called Sláintecare, which is our national policy, remains in place since 2017. So the areas of focus include things like our waiting list, access to care, shortening that down not just for acute services, but also for our community services as well. In addition, the whole ethos of Sláintecare is trying to shift care from the hospital to the community so people can have care undertaken as close to their home as possible. And we've seen some successes through the investment in our chronic disease programme and our specialist community networks, with teams focusing on older people, chronic diseases such as diabetes, respiratory and cardiology. There are also a range of other programmes around areas, our new children's hospital, our new national maternity hospital and our electronic health record, which we're now bringing a business case to government before the end of this year for approval to go out and commence a procurement process. In addition, we're refocusing now on children's services, and the CEO earlier this year announced that we were moving to a single point of access, single point of referral for families to try and address the issues that are there for families with children who have really significant needs that we're not addressing at the moment. Disability is another area of importance, as is mental health, and again significant programmes of change being undertaken in those services. In addition, this week we'll focus on a small number of initiatives to give you a better flavour of touching these things on the ground. So one will be to look at our surgical hubs, where we're seeing substantial work, and we'll focus on Mount Carmel, which opened earlier this year, which has already seen over 2,000 patients, a completely digital service, but more importantly, it's allowing patients to have reduced wait times. And that's one of a number of surgical hubs, with more to open next year in Galway, Cork, Waterford, Limerick, North Dublin, and also in future years in the northwest in Sligo and Letterkenny. In addition, we also are starting to advance significant work on artificial intelligence, and you'll see some examples of real benefits from that technology in the Transformation Week this week. That's alongside the day-to-day operational work that all of our staff in the health regions and in national services do on behalf of you, the public and patients, to try and improve healthcare. So again, many thanks, and hopefully you will, through this week, also take the opportunity to read up and look at all of the social media and other communications that are going to issue around these innovations that we're trying and that we're introducing and that are bringing real change. Thank you.